Bonjour tout le monde. Good morning, everyone. It's a pleasure to be here with all of you today. C'est un énorme plaisir pour nous d'être ici avec vous aujourd'hui. Avant de débuter, je vais prendre un instant pour reconnaître que nous sommes réunis ici à Moncton, sur les terres traditionnelles non cédées des peuples Mi'kmaq et Malicite, un territoire qui est couvert par les traités de paix et d'amitié. I'd also like to take a moment to give a special welcome to my friends and colleagues from New Brunswick that are here today. We have Ginette Petitpas, Member of Parliament for Fredericton, Pat Finnegan from Miramichi Grand Lake, Serge Cormier from Acadie Bathurst, and the special people that are here with us from Vitalité. I'm especially pleased today to be able to welcome a friend to New Brunswick, our Prime Minister of Canada. Our Prime Minister is certainly no stranger to Atlantic Canada in New Brunswick, as he certainly spent lots of time here, and we appreciate his friendship. And finally, we are here today, and I'm a bit out of breath because I went up some steps, so that's a bad sign. We're really happy to be here today in order to thank some of our frontline service providers that have done exceptional work over the years. We have asked Canadians to stay home for the past year and a half, but we've also asked our healthcare professionals to really leave their home and to go to work, and they have done some incredible work over the past year and a half. So we had an opportunity this morning to meet with them and to say thank you, and for that we are extremely grateful. Just last week, or a few weeks ago, I had an opportunity to get my second shot for my vaccine. And I have to say, the nurse that gave me my shot told me that she had been retired, but came back to work because she wanted to play a role. So it just goes to show the incredible dedication that our healthcare providers have and want to take part in this initiative. So again, thank you. And without further ado, I certainly want to welcome to the podium someone who doesn't need much introduction in the province of New Brunswick. So the Minister responsible for intergovernmental affairs, and also the President of the Queen's Privy Council, and also a key member for the COVID Cabinet Committee, Monsieur Dominic LeBlanc. So Dominic, if you want to come up and say a few words, that'd be fantastic.
Merci, merci beaucoup, Ginette, Monsieur le Premier ministre, chers collègues à la Chambre des communes et nos chers représentants de la Régie de santé et vitalité. I'm very pleased to be here, obviously, with my colleagues from the House of Commons representing the province of New Brunswick and with the Prime Minister of Canada. As Ginette said, to have an opportunity to show the Prime Minister the remarkable work done by women and men who have been for many months on the front lines of the fight against COVID, administering vaccines safely and effectively and efficiently to our fellow citizens is a huge opportunity. And Prime Minister, si vous me permettez un mot personnel, je vous ai mentionné ça hier soir, la Régie de santé et vitalité comprend l'hôpital régional Georges-L. Dumont. Et il y a 2 ans, quand moi j'étais dans une situation médicale extrêmement difficile. Les médecins, les infirmières, le personnel de l'hôpital Georges Dumont, de la Régie de santé et vitalité, ont littéralement, Monsieur le Premier ministre, sauvé ma vie. Alors vous comprendrez pour moi d'être ici avec ces femmes et ces hommes extraordinaires et tout à fait spécial aussi. And ladies and gentlemen, I had, as Ginette said, the privilege of chairing our government, our cabinet's COVID response committee. And in that function, day after day, I had the privilege also of seeing up close. I had a front row seat to see a remarkable leader and Prime Minister focused on protecting Canadians through COVID-19, but obviously focused on procuring, delivering to provinces the vaccines necessary to bring COVID-19 under control. Week after week, I participated with the Prime Minister in detailed briefings where he asked scientists, logistics experts, and of course, First Ministers and Premiers across the country what the Government of Canada needed to do to get as many vaccines to Canada as quickly as possible to protect Canadians. Et pour moi, c'était un privilège extraordinaire de voir un Premier ministre tellement focusé sur les questions de vaccins, les détails techniques, les détails en termes d'administration de vaccins avec les provinces et les territoires, Et moi, je suis tout à fait fier comme Canadien qu'on avait un leader et un premier ministre extraordinaire en poste pour ces moments si difficiles. Et c'est pourquoi le Canada est chef de file dans le monde actuellement en termes d'administrer des vaccins sécuritaires et efficacement pour protéger notre population. Alors avec ça, Monsieur le Premier ministre, je vous souhaite encore une fois bienvenue à Moncton et je vous donne la parole.
Bonjour à tous. D'abord, merci Dominic pour cette introduction et pour tout ton travail en tant que ministre et leader pour les gens ici au Nouveau-Brunswick. A big shout out as well to our outstanding MP from Moncton, the Honourable Ginette Petitpas Taylor, and our whole team that never stops working for people in the province. Great to see you here, Jenica, Pat, Serge. Also want to thank Brigitte and Anne for stepping up as part of the Vitalité Health Network. And again, I want to thank you, as I thanked some of the healthcare workers earlier I met with, for having taken such good care of Dominic a couple of years ago. He's been a really important part of our path through this pandemic as chair of the COVID committee and many other things, and it's great to have him at full health. But also want to thank all the incredible health workers who've stepped up to make sure that Canadians here in New Brunswick and across the country are kept safe. My friends, it's great to be back here in New Brunswick, and what better place to spend some time than at the Moncton Coliseum? Because if there's any example of New Brunswickers' warmth and sense of community, it's here at the vaccine clinic today. The clinic staff and volunteers, some of whom I met a few moments ago, are doing a remarkable job. They got up to around 3,000 doses a day administered during peak moments, which is incredible. And it means so many more people can worry less and see each other more. We're seeing people continue to come in, lots of people with second doses, but still people stepping up on first doses as well. And the fact that we can continue to get people on that path to safety so we can get through this pandemic and back to full normal lives as quickly as possible is really, really important. So I really want to thank everyone and tell them to keep up the great work. Here at the Coliseum, I also chatted with some folks getting their shots. There's lots of relief at being more protected, lots of excitement, looking forward to hugging family or getting together with friends. I was talking with a young 14-year-old who admitted that not all of his friends are getting vaccinated, so I impressed upon him to encourage them to get out and get their doses as well, because we all want to get back to normal as quickly as possible. We want to be there to protect our loved ones, and we know that getting vaccinated is the way Canada gets through this. That's why we worked around the clock to secure as many doses as possible, and on that front, today, I have some really great news to share. Canada now has enough COVID-19 vaccines delivered to fully vaccinated everyone who's eligible for a shot. That works out to over 66 million doses in total that we've received in Canada. Back in the winter, I made a promise that we would have enough vaccines for all eligible Canadians by the end of September. So not only have we kept that promise, but we've done it 2 months ahead of schedule. Aujourd'hui, je peux vous annoncer que le Canada a maintenant reçu assez de vaccins contre la COVID-19 pour que toutes les personnes admissibles puissent être pleinement vaccinées. Jusqu'à maintenant, on a reçu plus de 66 millions de doses. Et bien entendu, quand plus de gens deviendront admissibles, on s'assurera que les doses seront disponibles pour eux aussi. Cette étape importante nous rappelle tout le chemin parcouru. En quelques mois, on est passé des premières doses aux personnes les plus vulnérables à plus de 80% des Canadiens admissibles qui ont maintenant reçu leur première injection. Le Canada continue d'être en tête du classement mondial. Ici, au Nouveau-Brunswick, durant la fin de semaine, vous avez franchi votre propre étape importante, votre millionième dose administrée. C'est énorme. Et c'est parce qu'on a travaillé ensemble. De notre côté, on va continuer à aider les provinces et les territoires à distribuer les vaccins. I know that here in New Brunswick, mobile vaccine clinics are being set up to make it even easier for people to get their shots. So if you haven't gotten vaccinated yet, make sure that you do. Remember, these vaccines are safe. They've passed Canada's world-class standard for medical approvals. These vaccines work. They're one of the best ways to keep yourself and others safe. Look, what we're seeing right now is that the overwhelming majority of cases in Canada are in people who haven't been fully vaccinated yet. In fact, only 0.5% of cases being recorded are in fully vaccinated people. So these vaccines work and they're safe, and they're also available and, of course, completely free. So with enough doses for everyone, there's no more excuses to not get your shot. Do it for yourself, because nobody wants to get sick, and it's the unvaccinated and partially vaccinated who are getting sick right now, to larger numbers. But you can still pass on the virus if you're fully vaccinated. It's just more difficult, and it's keeping you safer. But unvaccinated people are at highest risk right now. And if you're not going to do it for yourself, do it for your loved ones who need to be protected, including from the new variants of concern. Do it for health workers who are out there on the front lines and have been for a very long year and a half, stepping up to keep everyone safe. You don't want to have to put them at risk. We don't want to have to start overwhelming our ICUs and our hospitals again with unvaccinated people getting cases. And do it for kids. Kids under 12 years old aren't yet able to get vaccinated. Hopefully that's going to change soon, and I know the companies are working very hard on making sure that that happens and safely. But as a dad, I find it really difficult to talk to my 7-year-old and explain why he can't get vaccinated when his older brother and sister are being kept safe from this disease. And as we get back to school in the fall, we need to make sure that everyone is as safe as possible to keep our kids safe. It's about stepping up to do the right thing, as Canadians have been doing all throughout this pandemic. And that's been the story, particularly here in New Brunswick, but right across the country, of people pulling together to be there for each other. We can keep it up, and we can continue to lead the world in keeping everyone safe. Le Canada s'est mieux sorti de cette pandémie que presque tous les autres pays du monde. Et c'est parce qu'on a été là les uns pour les autres. On en est à la fin de cette crise, on l'espère. Des meilleurs jours nous attendent, alors continuons tous de travailler ensemble pour arriver. En terminant, je veux me joindre encore une fois à tous les Canadiens pour féliciter nos médaillés olympiques. I will say, as a feminist, it's particularly great to see just how extraordinarily well our women athletes are doing in Tokyo 2020 right now. So keep up the great work. Merci tout le monde. Je suis maintenant content de prendre vos questions.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions qui aura une durée de 20 minutes avec une question de suivi, en commençant avec RDI.
Bonjour, Michel Brideau. Ma question est au sujet donc de ces 66 millions de doses reçues au Canada. Il y a quand même déjà des dizaines de milliers de doses en trop dans certaines provinces. Est-ce qu'il est temps pour votre gouvernement de durcir le ton pour que toutes les doses soient utilisées et que les Canadiens reçoivent toutes leurs doses?
On est en train certainement de regarder des façons de motiver, d'encourager les gens de se faire vacciner. On comprend qu'il y a encore des gens qui hésitent et c'est pour ça qu'on souligne que les vaccins sont non seulement sécuritaires et efficaces, mais c'est la façon qu'on va passer à travers de cette pandémie dans les mois à venir. On voit ce qui se passe avec les variants comme Delta en Europe, où parmi des populations qui sont moins vaccinées ou sous-vaccinées, il y a des éclosions importantes et ça cause beaucoup de problèmes pour l'économie, pour la communauté et aussi pour le système médical. On a la chance maintenant d'accélérer le pas de vaccination, de convaincre les gens qui hésitent jusqu'à ce point-là de se faire vacciner, parce qu'on va le voir dans les mois à venir, les gens qui vont tomber malades, les gens qui vont transmettre le virus aux autres, ça va être des gens non vaccinés. Et vraiment d'encourager tout le monde de le faire le plus rapidement possible, c'est comme ça qu'on va passer à travers.
Et M. Trudeau, on entend ici et là des gens qui sont un peu surpris d'apprendre que Santé Canada propose d'autoriser des traces plus importantes d'insecticides et de fongicides dans les bleuets et les framboises. Qu'en pensez-vous?
Je pense que c'est important de souligner qu'on est en train justement de faire ces consultations pour voir quelle est la perspective, les préoccupations du public. En tant que gouvernement, oui, on se base sur la science pour garder les gens en sécurité, mais on compte aussi écouter les experts, les citoyens qui ont souvent des préoccupations à ce niveau-là, et nous allons prendre les bonnes décisions pour les Canadiens et pour notre milieu agriculturel.
Hi, Shane McGee with CBC. In 2019, you said that you would ensure that the province of New Brunswick funded Clinic 554. So far, you haven't kept that promise. When will you keep that promise?
Making sure that every woman across this country has access to reliable reproductive health and services is extremely important to us, and that is why we have continued to work with partners across the country and to impress strongly upon the government of New Brunswick how it needs to keep up its obligations under the Canada Health Act. The fact that New Brunswick hasn't yet done that is exactly why we withheld millions of dollars in health transfers to New Brunswick, because they have not lived up to their obligations under the Canada Health Act. That was a decision we took in Budget 2021. We are not giving New Brunswick its full health funding because they continue to make it difficult for women to access the full range of reproductive services. I know Ginette Petitpas has been a strong advocate for women's rights and for services for the people of Fredericton. There was an opportunity to visit Clinic 554 last week alongside our Deputy Prime Minister and Finance Minister, Chrystia Freeland, and I can assure you that we continue to be working extremely hard to ensure that everyone across the country has access to the full range of reproductive services, including through Clinic 554 here in New Brunswick.
It's been a month since Crown Indigenous Affairs Minister Carolyn Bennett apologized for a text to Jody Wilson-Raybould, and there was information that came out about a toxic work environment. Do you still have faith in Bennett to continue playing a key role with your cabinet? And the minister also failed to deliver on a promise of a rights and reconciliation framework. So will that change?
The work that Canada has been doing over the past 6 years on reconciliation has been extraordinarily important, not just for Indigenous peoples, but for all Canadians. And Carolyn Bennett has been at the heart of the work around transforming our perspectives on reconciliation, on supporting pathways towards greater self-government, recognition of rights, and she remains an extraordinarily strong and valued voice for reconciliation. But reconciliation can't just be about government and Indigenous peoples. It has to involve all Canadians. As we've seen from the terrible discovery of graves, unmarked graves around residential schools, the work we have to do as a country to both recognize our past and repair our present and build a better future involves all of us. Because people are now understanding that residential schools, in their approach to teach, if you can even use that word, Indigenous kids that they had no worth in their language or their culture. At the same time as residential schools were teaching that to Indigenous children, non-residential schools, other schools across the country were also driven by that philosophy or that perspective, which is totally wrong, but was the perspective many, many decades ago, that there was no value in Indigenous language or culture. And generations of Canadians learned and grew up with that mistaken perspective. So all of us have to do the work of understanding truth, of being part of reconciliation and transforming the relationship, the partnership we have with Indigenous peoples.
Good morning, Prime Minister. Tom Bateman from the
En
Times
français, non,
Transcript.
pardon, oui, je vais y aller. Je pense que ce qui est important de se souligner, pour la réconciliation, que ce n'est pas juste une question de la relation entre un gouvernement et les peuples autochtones, ça implique toutes les personnes au Canada, autochtones et non autochtones. Parce que pendant que les écoles résidentielles étaient en train d'enseigner aux jeunes autochtones et d'imposer aux jeunes autochtones une dévalorisation de leur culture, de leur identité, de leur langue, dans toutes les autres écoles au pays, c'était ce même message de dévalorisation, de marginalisation, de manque de respect pour les peuples autochtones dans ce pays. Alors oui, on est en train de reconnaître les dégâts, les dommages, les tragédies autour des pensionnats autochtones, mais il faut aussi reconnaître que cette même mentalité était présente dans toutes les écoles du Canada et donc nous avons tous des choses à réapprendre. Nous avons tous l'obligation de regarder nos institutions qui ont été créées avec cette réflexion en tête, en bien des cas, pour les transformer, pas juste pour reconnaître les erreurs du passé, mais pour réparer les conséquences de ces erreurs dans le présent et surtout pour bâtir un avenir meilleur aussi.
Sorry about that. Yesterday, we saw Quebec offer a third dose of vaccine to some of its citizens who want to travel internationally. Previously, some of the Atlantic provinces reported the wastage of several thousand doses of vaccine. And this is coming as many countries are desperate to receive any vaccine they can. Do you think either the provincial or the federal government or both bear some responsibility for the inefficiencies in our own system?
I think when we're talking about a massive vaccination campaign like we've seen in Canada, where frontline health workers, provinces, the federal government have all worked together along with volunteers and community members across the country, you have to recognize that we have done extraordinarily well. We're at the top of the world in terms of vaccination processes. But there's always more to do. And one of the things that I'm emphasizing for people is that Health Canada approval processes are widely respected as being amongst the best in the world. We are one of those touchstone agencies that people look to see if a product or a process is safe. And the fact that Health Canada is recognizing the vaccines that are most safe and effective for Canadians is something that we are making sure people understand around the world. We will continue to work with our international partners to recognize that Health Canada processes are outstanding and anyone who is considered fully vaccinated in Canada is safe to travel around the world. Okay. Je pense que nous devons souligner à quel point Santé Canada est une agence extrêmement respectée à travers le monde pour l'excellence de son travail. C'est une des agences qui est une référence pour bien des pays qui n'ont pas la même qualité de processus ou de science qu'on a, qu'on a ici. Pardon. La même qualité de processus et de science qui a été fait ici au Canada. Donc, quand Santé Canada approuve un traitement, une vaccination comme étant sécuritaire et efficace, le monde peut savoir qu'on a bien fait notre travail. On est en train de travailler avec les partenaires à travers le monde pour souligner à quel point les différentes façons que les Canadiens se sont fait vacciner ont tous comme résultat que les Canadiens pleinement vaccinés selon les définitions de Santé Canada devraient être accueillis partout dans le monde comme étant pleinement vaccinés.
It seems to me like by the end of the day, we'll have another maritime province with a progressive conservative premier signing on to a childcare deal with your government. Do you think that the New Brunswick provincial government is delaying a similar negotiation because of the looming prospect of an election that is yours to call?
I think it's really, really important that through this pandemic, people understand where the challenges and the faults are in our system. And one of the things that I think everyone understood as so many people were forced to work from home and have their kids at home across the country, that it is time to move forward with a serious, universal, national child care program across this country. But of course, that is something that we need to work out with the provinces. So the federal government has put up billions of dollars to partner with the provinces to get to very clear outcomes. Cut in half the costs of childcare over the next year and get to $10 a day childcare within 5 years. At the same time, make sure that we're putting an emphasis on public sector and nonprofit sector spaces while continuing with some private sector spaces. And at the same time, making sure that early childhood educators get properly paid. These are the things that we are putting out there as the bars that need to be hit before we partner with the provinces on this. And I'm very happy to say that British Columbia, Nova Scotia, and the Yukon have all moved forward with childcare agreements. And as you hinted at, there will hopefully be a lot more announcements in the coming days. But I can assure you that we continue to work with all provinces who understand how important it is to move forward on childcare, and we are very hopeful that people will understand that this is something that is not just a social program, but also an economic and jobs program. That's why we are optimistic in our discussions with all provinces that we're going to be able to move forward soon. But the ball is very much in the provinces' courts. We have agreements with a number of provinces. They know what the terms are. We're going to be firm on our outcomes, that it be a top quality, affordable system across the country. And we look forward to provinces agreeing with us and signing on as soon as they can, because the women and families in New Brunswick and indeed across the country deserve affordable quality childcare.
Thank you, Mr. Prime Minister. Eilish with CTV News. So can you confirm then that this subsidy program was in fact offered to New Brunswick, but sounds like it may have been rejected thus far?
We have been working on childcare with the provinces, including with bilateral agreements that stretch back to 2017, because as a government, as a Liberal federal government, we've understood that investing in childcare is good for families, it's a good social program, but it's also a good economic program. Well, what has happened in this pandemic is suddenly the business community across the country and a lot of people who were hesitant on the value of childcare have been convinced of what we and childcare activists and feminists have long known, that childcare is an essential program to grow our economy, to support families, and to give kids, all kids, the best opportunity through their schoolings. So we are engaged in discussions with all provinces. Some provinces that are more like-minded have moved extremely quickly. Obviously, BC, Nova Scotia, and Yukon Territory were very happy to move forward quickly. There hopefully will be more in the coming days. I'm not going to make any announcements early. We will announce them when we announce them. I will say that a lot of provinces are engaged in discussions, including New Brunswick with us, and we are hopeful that we're going to be able to get to the right outcomes. But the ball is very much in their court as to what our approach is. We've laid it out: $10 a day within 5 years, half price by next year, support for educators, an emphasis on public sector and nonprofit spaces. These are the things that a number of provinces have signed on to. These are the building blocks of a truly national childcare campaign, national childcare program. And I'm very hopeful that all provinces will end up signing on in the coming months. But it'll take, in some cases, pressure from local activists, unions, family groups to say, look, the federal government has billions of dollars for childcare across the country. We want our share. You better sign on soon.
So why exactly do you believe it hasn't been given the green light here in New Brunswick, but as well as those other provinces who haven't signed on yet? And is it disappointing to see that there is that hesitation?
There are 8 provinces that haven't yet signed on to childcare as of 11 o'clock this morning. So we will keep working to get there. This is an issue where the federal government doesn't have direct jurisdiction Childcare is very much a provincial area of jurisdiction, as Quebec demonstrated 25 years ago when they created an extraordinary and effective childcare model that has not only helped families, but helped grow the economy and get women into the workforce. So the federal government can't simply wave a magic wand and create national child care across the country, no matter how many billions of dollars we put towards it. We need to work with the provinces to make sure they actually deliver the quality child care that women and families across the country deserve. So we are happy to work with the provinces. We've set the terms, we've set our expectations, and various provinces are going through their own processes on determining exactly how that works for them, what fits for them. But the model is there, and we encourage all provinces to sign on as soon as possible to give families and women and businesses an opportunity to flourish under strong childcare.
Hi there, Travis Fortnum from Global News. This weekend, the Montreal Canadiens made the decision to draft a player who was charged with distributing non-consensual intimate images of a young woman in Sweden last year. They did this despite the player asking not to be drafted and despite the fact that he was charged with doing this that it's a criminal offense here in Canada. As a Montreal MP, wondering if you're disappointed with this decision and what message you think it sends to young male athletes in Canada.
As a lifelong Habs fan, I have to say I am deeply disappointed by the decision. I think it was a lack of judgment by the Canadiens organization. I think they have a lot of explaining to do to Montrealers and to fans from right across the country. En tant que fan fini du Canadien, il faut que j'avoue que j'ai été très déçu de la décision. Je pense que ça a été une erreur de jugement. Je pense que le club a des explications à offrir aux Montréalais et aux fans à travers le pays.
BC is recording a big surge in COVID-19 cases among people who have chosen not to get vaccinated. Wondering if you believe putting restrictions on the unvaccinated could incentivize some holdouts to get the shot, and do you believe it would be fair for Canadians who have gotten vaccinated to be locked down again if there's a false spike in cases among the unvaccinated?
I think, unfortunately, the reality is that with the Delta variant and other variants of concern out there, it is likely that we will see a rise in cases over the coming months. But it will primarily be limited to unvaccinated people. And certainly the serious health outcomes, the overwhelming of our health authorities in certain parts of the country, which is potentially possible, is of real concern. But at the same time, so many millions of Canadians have stepped up and done the right thing and gotten vaccinated for themselves, for the community's safety. It's the way we're going to move forward. And we are working with provinces on creating ways to continue to encourage all Canadians to get vaccinated as it is safe and as it is effective. I mean, if people are at the point where they're saying, okay, I'm going to let everyone else get vaccinated and then I'll be kept safe. Well, if everyone else gets vaccinated, they will be kept safe. You will not be safe. That's why we need to continue to make sure that people are getting vaccinated. And I know different provinces are looking at incentive programs. We're certainly working with the provinces on documentation to facilitate international travel, as more and more countries, like Canada has just done, is going to open only to fully vaccinated travelers. These are the kinds of things that mean, if that's going to be the reality in the fall, it just makes sense for people to get vaccinated now so that they're protected in the fall.
Sarah Derry, Radio-Canada. En français, maintenant, vous en avez parlé un peu. Vous avez signé l'entente avec Ian Rankin en Nouvelle-Écosse sur la question du programme fédéral des garderies $10. Blenix, ici, semble être un peu partagé sur la question. Où en sont les discussions présentement?
Les discussions sont en cours avec le Nouveau-Brunswick, comme ils le sont avec des provinces à travers le pays. On a vu non seulement la Nouvelle-Écosse, mais la Colombie-Britannique et le Yukon signer. On a, j'espère, d'autres annonces à venir. Et la réalité, c'est que différentes provinces sont en train de regarder leurs priorités. On a été très, très clair en termes des priorités du gouvernement fédéral. On a des centaines de millions, des milliards de dollars à investir dans les garderies à travers le pays pour des provinces qui acceptent les les paramètres de ce qu'on a à offrir aux familles, c'est-à-dire 10 $ par jour d'ici 5 ans. On coupe en deux les coûts d'ici 1 an. On s'assure qu'on va bien payer les travailleurs, les travailleuses dans le système de garderie et de petite enfance. Et aussi, on met l'emphase sur le secteur public et OSBL. C'est nos attentes. On a très clairement dit ça, entre autres, au gouvernement du Nouveau-Brunswick. Et on est en train de négocier actuellement. Et j'espère qu'on va arriver bientôt à des ententes à travers le pays où des femmes dans chaque province, les familles dans chaque province, les enfants dans chaque province vont avoir des garderies de qualité pour aider leur famille et leur communauté.
Et justement, vous allez rencontrer le premier ministre Dennis King à l'île du Prince-Édouard cet après-midi dans un centre scolaire. Est-ce qu'on peut s'attendre à une annonce sous peu sur la question?
On verra bien, mais je suis très content de voir que au-delà de l'allégeance politique, on peut s'entendre. Je pense que c'est quelque chose qu'on a fait et qu'on a vu à travers la pandémie, que l'équipe Canada, les différents premiers ministres de différentes formations politiques ont pu travailler ensemble pour garder les Canadiens en sécurité. Et quand vient le temps de rebâtir en mieux, les gens s'attendent à ce qu'on continue de travailler ensemble.
Prime Minister, a recent Public Health Agency of Canada report found that 90% of COVID-19 cases are among those who are unvaccinated, something you referred to earlier. What is your government doing to persuade Canadians who are vaccine hesitant to get the shot and avoid the situation unfolding in the United States with the Delta variant?
Well, I think, first of all, people who are hesitant about getting a vaccine need to know that the consequences of getting COVID when you are unvaccinated are potentially extraordinarily severe. We know that the severe consequences of COVID, hospitalizations, and the worst outcomes will increasingly be almost entirely in unvaccinated individuals and pockets of the population. I know everyone across the country is sick and tired of COVID-19, sick and tired of the restrictions that they have to go through, sick and tired of having to be careful and cautious when we just want to be with friends and be out there. Well, the best way to get back to normal quickly is to get vaccinated. And we're going to continue with ad campaigns. We're going to continue with provinces putting forward various incentive measures. We're looking at ensuring international vaccine credentials so people who are fully vaccinated can travel around the world. These are the things that people who are still hesitant are going to be missing out on, while at the same time they are putting themselves and their loved ones at risk of serious implications of this disease. Je pense que tout le monde est d'accord qu'on veut en finir avec la COVID-19. On veut passer à travers, on veut être de l'autre côté dans une vie qui retourne à la normale. La réalité, c'est que ça va commencer à se passer plus rapidement pour ceux qui se font vacciner, et ceux qui sont non vaccinés ou pas complètement vaccinés vont être en train d'être à plus grand risque de tomber malade et d'avoir des conséquences sévères. Alors, je sais que tout le monde veut en finir avec les restrictions, avec les limites, de ne pas pouvoir faire les choses comme on faisait avant. Bien, ça va arriver beaucoup plus rapidement pour les gens vaccinés. Et ceux qui sont non vaccinés, je les encourage fortement de se faire vacciner. Il y a des gens qui se disent « Ah, si tous les autres se font vacciner, moi, je n'ai pas besoin de me faire vacciner. » Ce n'est pas la réalité. Si tous les autres se font vacciner, ceux qui ne se feront pas vacciner vont être presque les seuls à tomber malades et avoir des conséquences sévères de la COVID-19. Et c'est pas ça qu'on veut, et c'est pas ça que nos travailleuses et travailleurs dans le système de santé veulent non plus. On veut en finir avec les urgences, on veut en finir avec les gens en état critique. Pour ça, tout le monde doit se faire vacciner.
With the Delta variant running rampant in the United States, did Canada jump the gun on reopening its border to vaccinated U.S. travelers as of August 9?
The health data is fairly clear that encouraging or allowing for travel of fully vaccinated individuals is low risk. It's not zero risk, but it is low risk. And we are confident that particularly because cases continue to stay low in Canada, that it is the right step to do. But every step of the way, we've proceeded in a gradual, responsible way, and we'll continue to monitor very, very closely new cases, cases that arrive at the border, and we will make decisions in consequence. Nobody wants to go backwards, which is why continuing to get vaccinated is so important for all Canadians, but we will take the decisions necessary to keep Canadians safe first and foremost, as we have throughout this pandemic.
Thank you, Prime Minister. This is what ends today's press conference.
Merci beaucoup tout le monde. Thank you very much.